No more pregnancy. You may be curious, when does the pregnancy process start and how is it divided? In fact, it starts from the moment of successful fertilization. After that, different periods are roughly divided according to the growth stage of the fetus. Usually we call them early pregnancy, middle pregnancy, late pregnancy. 1. Early pregnancy, 1 to 12 weeks after successful fertilization. The early stages of pregnancy are the most difficult stage for new mothers. During this stage, they will begin to experience physical challenges, which is what we often call early pregnancy reactions. Usually there will be symptoms such as vomiting, nausea, loss of appetite, dizziness, etc., and you will begin to feel physical. She is quite tired and often feels low-spirited. She may also reject certain foods at this stage, but she must take in enough nutrients to support her baby's development, which is a big challenge both physically and mentally. 2. Second trimester, 13 to 28 weeks. After surviving the hardships of the first 3 months, we enter the second trimester of pregnancy. At this stage, the development of the placenta is relatively complete, and the probability of miscarriage is relatively lower than in the early stages of pregnancy. The fetus has slowly taken shape, and you can even start to feel slight fetal movements. At this time, mothers usually regain some vitality and begin to make more changes in their diet. When taking in the nutrients that the baby needs, they must also remember to control the calories they take in or supplement it with exercise to avoid becoming overweight. Or being too thin can make childbirth go more smoothly later. 3. Late pregnancy, around 29 to 40 weeks. In the later stages, many potentially dangerous situations must be avoided. The weight of the baby during this period will begin to put pressure on the mother's ankles, pubic bones and other joints. She may also feel back pain and bladder weakness due to holding her belly for a long time. But this stage is also full of joy and expectation. At this time, you can clearly detect the baby's activities, and through the fetal movements, you can seem to feel the impatience that the baby is about to be born. During the pregnancy process, pregnant women need to pay special attention to the following 5 points. These messages may reveal that there may be problems with the mother or the baby. They can observe the phenomenon early and understand the baby's condition at any time. 1. Abdominal pain. Abdominal pain during pregnancy has many possibilities, but it should never be ignored. It is best to record the feeling and location of abdominal pain when it occurs so that the cause can be found more quickly. Whether it is a simple minor illness or a more serious condition such as organ inflammation or placental detachment, early treatment can protect the mother and her baby. 2. Growth rate slows down. Generally speaking, we can still judge based on the number of weeks. If it is found during the prenatal checkup that the fetal growth rate is 2 to 4 weeks slower than normal, then more detailed examination may be needed to see if it is a genetic problem. Insufficient nutritional intake, or is there abnormal placental function? Seek medical assistance. 3. Abnormal fetal movements. Generally speaking, when you start to feel fetal movement, usually around 17 to 22 weeks of pregnancy, your baby will usually have more than 10 fetal movements in half a day. If the number is less, you should pay attention to check the reason. Generally speaking, it may require special attention due to conditions such as premature birth, umbilical cord wrapped around the neck, or poor production. 4. Pay attention to the delivery date. In addition to tocolysis to avoid premature birth, pregnant women should consider the physical condition of the pregnant woman if she has not given birth after the expected date of delivery. While observing, she should also prepare for induction of labor to prevent the placenta from gradually shrinking after 38 weeks of pregnancy. Aging. If you are almost over 42 weeks and have not delivered successfully, you will need to undergo artificial induction. 5. Abnormal fetal heart sound. Fetal heartbeat is the baby's heartbeat. It is best to maintain it for a period of time when observing, about 10 to 20 minutes, so that the number obtained will be more accurate. The general normal value is 120 to 160 bpm. If the observation is too low or if it is too high, seek medical attention as soon as possible. It is recommended that expectant mothers should be fully prepared and adjust their mood. Because stress can also have an impact on the baby, stay optimistic and not anxious. Let nature take its course during pregnancy, and take care of yourself and the baby, so that you can successfully give birth to a healthy baby.